Well, welcome. My name is Jay Otto. I'm a researcher with the Center for Health and Safety Culture at Montana State University, and I'm really pleased to have this opportunity to talk about a really interesting project we did, and very excited to be able to do this with my colleague, Annmarie. Annmarie, you want to introduce yourself?
Sure. Hi, I am Annmarie McMahill. I'm a research scientist for the center as well. I'm also the center manager. So yeah, I'm excited to be here. Thanks.
Great. So I'll just give you a little bit of background on Webex. I think one of the unintended consequences of the pandemic is we've all gotten much better at using distance technology, but all the platforms can be a little bit different. You do have access to a chat box like you were using, so you can put things in that, and that's one way that you can communicate with us so that we can see any questions or thoughts you may have. You can also access a Q&A box and put things in there as well. So Annmarie and I both can see those. We'll try to keep an eye on those as we're going. We might answer your question on the fly when it comes in. We might delay. We're going to have some chance at the end to also address questions and answers. So if we don't immediately respond to your question, don't worry, we're just holding it and we're going to bring it up later on. If for any reason you get disconnected during the call and you called in, you can re-access either with the little phone icon or the three dots icon at the little three buttons towards the bottom of your screen, and you can reconnect to the audio if for some reason you should be dropped. But hopefully you won't be, and we won't have any issues there. I'm now going to turn it over to Annmarie to talk a little bit about our center.
Great. So the Center for Health and Safety Culture, we're an interdisciplinary center that conducts research on how culture impacts health and safety. We conduct applied research in partnership with community, state, tribal, and national organizations who are seeking to improve health and safety. And all of our research is applied and sponsored by organizations seeking to make a difference.
Great.
All right. So a lot of our work covers a lot of issues, but predominantly these four. And so together, these issues have a profound impact on public health, and they're really the leading causes of years of potential life loss. We know that they also overlap. We know the misuse of substances has impact on traffic safety, and violence and child well-being are impacted by substance as well. All of these are interconnected, and so at the federal, state, and community level, these are issues, they're addressed in a lot of different ways. And for us, it's interesting to see how departments of transportation approach behavior change and health and safety compared to efforts to reduce underage drinking, for example. So working in these four domains is really insightful for us, and our big picture is to step back and look at an overall approach that transcends any given issue.
Super. All right, well, thanks for that setup. Our purpose today is to review some results of a survey that we were able to do in Washington State, and it was particularly among parents about their beliefs and behaviors regarding teaching their children about safe driving practices. So that's our goal. We're going to go over much of what we learned on the survey, but not everything. And we're also going to be continuing to release some information. We're continuing to write some articles and different pieces of information about this project as well. So it's really something, although we collected the data about a year ago, it's something we're still working on exploring and understanding. As many of you may know, motor vehicle crashes are the leading cause of death for teenagers in the U.S. So it is a major public health issue. We're also seeing nationally that suicide is becoming a major concern. So nonetheless, traffic safety is just a really significant public health issue for everyone, but in particular for young folks. The research is also very clear that crash risk is particularly high immediately after one gets a driver's license. So there's definitely this sense of high risk associated with young drivers and drivers who have recently been licensed, and that that risk does decrease with time. So whether that's sort of experience, learning, maybe a little bit better focus, all sorts of things can come to bear. Now, we also know that licensing amongst youth is changing a little bit in our country. Things have, we're seeing the age at which young people get a license get older and older. So not as many youth are getting a license right at 16. Some are delaying to 17 or 18, maybe even later. That also has some interesting impacts because different states have different rules about requiring driver's education classes. And sometimes those requirements can be decreased with the age of a person. So that can also be interesting to note that as people are delaying when they seek to get a license may impact the education that they receive. So it's just a very interesting public health issue, which is why we're very interested in it. But it's also just this interesting situation because our lens, and I think lots of people's approach, would recognize that people don't just learn how to drive when they start driver's education class or when they seek to get their license, that process begins much, much sooner. So we really recognize this interesting opportunity that children and youth have many chances to learn about safe driving before they ever drive, right? As occupants, very young age children are occupants in vehicles all the time. And those are interesting opportunities where they can learn safe driving practices. Likewise, they might learn unsafe driving practices. But it's just this recognition that the learning can begin at a much, much earlier age, way prior to any real efforts around getting a license. And we had some great conversations, a wonderful sponsor that we do a lot of work with, the Washington Traffic Safety Commission, an organization we really view as leading traffic safety in the country, were able to sponsor us to conduct a survey and explore this, and really explore the beliefs and behaviors of parents relating to actions they can take to teach their children safe driving practices. And very much looking at this through the lens of, yes, there's a period, even a specific period during maybe education to get your license where you need to get some driving time, and often that driving time is with a parent because it has to be with another adult who's often over, an older adult, maybe over the age of 25, or somebody who's had a license for several years. So you have that time in the vehicle where a young person is practicing, and an adult, which I think often is their parent, is in the vehicle with them. But even prior to that, there's so many interactions between a parent and their child in a vehicle that creates this opportunity. So at the center, whenever we approach our work, we tend to approach that work through thinking about what behaviors do we want to grow, and then what is the belief system that is associated with those behaviors. We really take a behavioral model approach to our work, and our goal ultimately to improve health and safety is to grow protective behaviors and decrease risky behaviors. But we recognize that behind growing behaviors is really the work of growing supportive beliefs. So this is a synthesized behavioral model that we use. We didn't really create this behavioral model. It's a synthesis of various behavioral models that we sort of brought together. And it recognizes that individuals who have a higher willingness and intention to engage in a behavior are more likely to engage in that behavior, and that's on the far right-hand side of the model. And that there are multiple beliefs captured here in green that will influence an individual's willingness and intention. And all of these beliefs are opportunities that we can grow those beliefs through various interventions to support the behavior or decrease a risky behavior. And then we also know that individuals have values and assumptions which will influence the adoption of those beliefs. So when we develop surveys or try to understand behaviors, we really try to look at what's behind all of these different boxes or kinds of beliefs. And that's what we're going to explore in this presentation, is to look at the various beliefs associated with specifically some behaviors around parents and their engagement in teaching their children safe driving practices. We always do begin with the conversation, well, with what behavior or behaviors do we want to grow? And I'm going to ask Annmarie to talk a little bit about that in terms of specifically what kind of behaviors we were trying to grow in this context.
Sure. So I'll spend just a little bit of time going through each of these. And for me, I always want some concrete examples. So the first behavior is getting input. Getting input is about purposefully creating an opportunity to interact and engage with a child by allowing them to take an active role in conversation about driving behaviors. So instead of telling a child like what to do or lecturing them or giving advice, you invite them into participate in the dialogue, and that really engages the logical part of their brain. So one approach to doing that is by asking open-ended questions. So getting input might sound something like, who should go next at this four-way stop? Or what did you think when you saw the lights on the school bus begin to flash? How do you think we should handle the call coming in on the cell phone when we're driving? This is a way to explore together and navigate a conversation collaboratively. And so really, it's just as simple as, what do you think I should do here? Or how would you handle that? The second behavior is teaching. And so it demonstrates like how to do a task successfully and equips a child with knowledge and skills. It obviously builds their capacity and sets them up for success in the future. So this might look like teaching about demonstrating safe passing, or saying like, I'd really love to show you how to parallel park. Practicing is the third behavior, and it's all about experiential learning. So oftentimes kids learn by doing and applying what they learn, failing, redoing it, repeating the process. So through that practice, a child can grow skills. So that means you have to create opportunities for a child to practice. That doesn't mean like giving your 12-year-old keys to the car, but it's intentionally allowing them an opportunity to practice and avoiding like direct solutions or solving a problem. So that might look like, walk me through the steps I take as I, can safely pull out onto the highway, or tell me when it's my turn to go at this stoplight. Support is the fourth behavior. It can include things like coaching, providing feedback, reteaching, reflecting. It might sound something like, if you had to redo that, what would you do differently? And then recognizing effort is the fifth behavior. And it's really being intentional about recognizing efforts and successes, no matter how small the successes are. Acknowledging them is important. So one thing about recognizing effort is it should focus on the effort, like the process that a kid engaged in, or other aspects of their behavior that are controllable. So like you praise a behavior and not a characteristic. So it might sound like, I could see you did a really great job thinking through that situation, or I'm really impressed with your understanding of that four-way stop. Or you walked me through that like a pro. It could also be like a hug or a high five or a fist bump. Anything else, Jay, that you wanted me to add on the 5 behaviors?
No, I think that's great, but I think it gives one a context that clearly these are behaviors that a parent can engage in with a child virtually at any age. I mean, we're not obviously thinking about this with infants, but even 5, 6-year-old child, a child can be very interested in what's going on in the vehicle and going around, and those conversations could begin then. And obviously become much more in-depth and much more intentional as the child gets older and approaches the age of getting a license. This is also an area of research that Annmarie really focuses on, and many staff members at the center do, but thinking about growing skills among youth and amongst others, but really through a multi-step process. We often think about, I think, growing skills as largely just the teaching, but thinking about these other steps as being so important to really growing skills is a big insight. And so we wanted to explore this and how were parents connecting with this as they thought about this context of growing safer or raising safer drivers. So I really appreciate that. And so when we think about this behavioral model and that gray box, we're really thinking about these 5 behaviors. And we attempted in the survey to really understand beliefs supportive specifically of some of these. Sometimes just because of survey length, we had to look at beliefs supportive of just the whole general process of engaging and teaching your child to be a safe driver. But nonetheless, in our thinking, we were always had these 5 steps in mind. We included these in the language of the survey and talked about them and thought about that as we developed the survey and thought about the behavioral model. So the participants in the study were 800 parents, specifically from Washington State. They were recruited online in the fall of 2019. It is not a representative sample. They were recruited online as a convenience sample, but 800 is a large number of participants. So it's helping us move beyond maybe some limitations. Nonetheless, all of the folks who participated did, have access to internet. This survey was done in English, so there are certainly limitations of people who did not participate. All of them also had a child between the ages of 6 and 18. Slightly over half were female. The median age was 40 years, so half the respondents were under the age of 40 and half the respondents were over the age of 40. The mean was 41 and the standard deviation was about 8 years. Predominantly white, but we did have some representation from other races as well. And most, almost 7 out of 10, had at least one child with a license to drive. So not all of them, but many of them did. And that was valuable for us. I mean, we really wanted to sort of have it hone in a little bit of that age and have that sense of some experience of people who had a child get a license to drive. So some of the things we wanted to check in on was just sort of parental concern about this, sort of where were parents coming in general. When we sort of think about some of the aspects of values in the behavioral model, it's just sort of how does concern come in, sort of concern around health or safety related issues. And this is a question we often ask on our surveys, just agreement with a zero death goal. Washington State has very early adopted a target zero goal. The zero is the only acceptable goal for deaths and serious injuries. Many states have. And overwhelmingly, parents agreed with that goal. That number went up even higher if we asked them about the only acceptable number of deaths and serious injury among their family and friends. But nonetheless, 84% is a high level. You might wonder, why wouldn't somebody agree with that? Well, sometimes there are folks who don't necessarily agree with that because they don't feel like it's attainable. Therefore, they can't agree with it. But we really, and I think in traffic safety, recognize it's the only acceptable goal we should have. So we have to constantly seek to get there. Interestingly, about 6 out of 10 just agreed that they would like to improve the safety of their driving. I mean, we wanted to include that just to see what their interest in safe driving was, even for themselves, let alone for their child. And that surprised me a little bit. I didn't think that was going to be so high. And that was just really interesting to see that 6 out of 10 respondents were interested in improving their own driving safety. And about 9 out of 10 were moderately or more concerned about their child learning to drive safely. So it was in their attention. Now, that's not 100%, but nonetheless, it's a good number. It's a good place to start with. We've got a lot of parent concern out there. And so when we think about sort of basic motivation to engage in some of this topic, we feel like we've got many parents who are there. Clearly, there's opportunity to grow that, but it's a good place to start. we asked an open-ended question. And we always find this is kind of interesting on surveys because most of our survey questions tend to be more close-ended, so they're given a series of options that they're responding to. But we just gave them 3 open boxes that they could type anything they wanted to into. And we asked them, what are 3 skills a youth should have to be a good driver? And this is a sort of a word chart of the size of the text is the prevalence of their response. And they really came up with things which dominated with sort of attention and focus and awareness. And I think that's really good to see. I mean, those are overarching big skills, very important. Obviously, we have specific driving skills as well, but that notion that they need to be focused and attentive to the driving task is so important, right? This is a very demanding task. We're driving very large vehicles that have a lot of mass, can do a lot of damage, especially at high speed. And parents are sort of getting at that notion of attention and awareness as being important, just from a blank, open-ended prompt. We then asked them sort of how much they were engaging in those behaviors that Annmarie described. So getting input, what we saw was about a quarter of them reported sort of rarely or never doing that, about half saying sometimes, and maybe, 1 out of 5 saying usually or all the time. You can see their engagement on teaching was a little bit higher. And we often are starting to see this pattern when we ask about parents engaging in activities with their children. The getting input is often the least prevalent one, but we often see it as the most important one. Because another pattern you can see with surveys is if you ask the youth, have you had good conversation with your parents, let's say about underage drinking? The youth will say, no, I've not had very good conversations with my parents. But the parents will say, oh, we've had lots of conversations about it. And the issue is, it's probably not a conversation, right? The parent is just saying something and thinking that it's done, but the youth was never really engaged in the conversation. So this getting input is extremely important just to get them cognitively engaged and to have them have ownership and participation in the conversation. Teaching, as we said, was a little bit higher. Practicing, maybe parents don't realize that a child could cognitively practice safe driving even though they're not behind the steering wheel. And it's something that parents might just not have realized, like, oh, yeah, I could ask my child at a 4-way stop, who do you think goes next? Or what does it mean when we suddenly see the yellow flashing lights on a school bus? And just all sorts of opportunities to ask a question where a child can look at a situation and practice cognitively what safe driving looks like. Supporting, yeah, parents tend to be supportive, but opportunities to potentially grow that. And then recognizing effort. And that recognizing effort is so important in that it can create that intrinsic motivation for learning as they're figuring it out and bolster the child's willingness to be able to ask questions and continue to learn. So we saw that some parents were engaging in various levels of these, certainly room to grow, but there was definitely some good starting behaviors that we could build on. We also asked specifically parents teaching or asking about teaching on specific behaviors. So we asked them, how often do you talk about or teach your children about this list of different behaviors? And you can see seatbelt use is high. That might make sense, right? Because the child or the youth can wear a seatbelt. So it's an action that they can behave in even though they're not driving. These other behaviors are really about largely driving behaviors, so the youth isn't in the driver's seat. But nonetheless, so you can see that the engagement in teaching about these specific behaviors is much less. Some are lower than others. What we're looking at here on the chart is the average response. So the average, that doesn't mean everybody responded that way. And the width of the box is like the 95% confidence interval. So you can sort of see there's definitely room to grow, lots of conversations about teaching on these other important behaviors and aspects of driving, which we know are related to crash risk. We wanted to get to a sense of parent willingness to engage in this. And some things we learned that parents were more willing to engage in these conversations when their children were older, like ages 16 to 18, compared to when they were younger. So maybe they aren't seeing the connection as much. Maybe they don't see the opportunity to have those conversations. They definitely see a greater willingness as they're approaching, age to get a license. But maybe there's an opportunity to help parents say, hey, you can have these conversations even when they're younger, and prepare them for these later conversations. Parents did indicate they would be more willing to engage in these conversations if it was shown that these conversations are effective. So that's, puts a burden on us, the researchers, to start to look at how we can collect evidence that these kinds of conversations can help grow safer drivers, and then reflect that information back to parents, because that would really help them motivate. In that sense that parents are looking for things that are effective to help their children be safer. And this one was really interesting. Most parents, just about 8 out of 10, were moderately or more interested in having access to online resources that could help them engage in conversations about safe driving practices with their children. That surprised me, of sort of an already baseline level of interest. If we had access to resources, we might really look at those and go right there. And that was exciting, because I think it's something that we could do as all of us collectively working on traffic safety to help parents have better conversations there, and that parents were already coming to the table with interest. We wanted to look at some behavioral beliefs. So these are sort of positive or negative expectancies that parents might have about having these conversations. One, there was a strong recognition amongst the parents who participated that they recognized they do play a critical role in teaching their child how to drive safely. Not everybody agreed with that, but most did, and that's a great place to begin. Fewer agreed with the notion that their child has been learning about driving for as long as they've been riding with them. And I think that's an opportunity just to educate them. Like, children are just absorbing information all the time, and every time they're in the vehicle with you, they're consciously and subconsciously learning about what safe driving looks like. And maybe helping parents realize that, and then being more intentional with using those opportunities. The sense that children learn a lot about driving as they ride with their parents, they sort of got that, but maybe not fully connecting it back with that intentionality and that aspect of fully learning. Now, the next one is interesting, sort of driving as a skill you can only learn by doing yourself. About half disagreed with that, and 4 out of 10 agreed, some folks in the middle as neither. But I think we want people to realize that driving is a skill that you can learn before you get behind the driver's seat. It's not just about the mechanics of operating the vehicle, but all of the decisions that we make in so many different contexts of driving that then inform the actual behavior we take in the moment. So I think there's an opportunity to help parents realize, no, there's a lot of driving skill that we could develop before we're even behind the wheel. Some folks, most of the parents, 3/4 disagreed with this notion that there really isn't much they can do, but that left about a half or a quarter not disagreeing. So some parents are feeling like they can't really impact their kids or teach them. We think that's not true. We think most parents absolutely can, so we want to grow that, but they might need some tools and resources to do that. And then there are definitely some parents who feel like, my child never listens to me. It's very interesting that certainly on other behaviors, let's say underage drinking or the misuse of substances, many parents will feel like, well, my kid never listens to me. It doesn't matter what I say. But if you ask the youth, parents remain one of the most trusted sources of information. not for every child, but overwhelmingly the majority of children. So they might not say that, like a teenager's never going to say, oh, Dad, you're brilliant. I totally agree with you. Like the teenager's never going to say that, but they might actually think that and feel that. So that might be a misperception that parents have, but we recognize from lots of other sources of research that parents do have a profound impact on their children, but the children are never admitted. We also wanted to look at what are called injunctive normative beliefs, whether parents felt like they should do this. This sense that it's their responsibility, and do they sense that other people who are important in their lives would also agree that parents should do this? And overwhelmingly, parents did approve of engaging in these conversations. They didn't feel like it was out of their place. They approved of it. So that's a great place to be. And most of them, without a doubt, perceived that their spouse or partner would approve, even that their child would approve. But it's interesting that that's a little bit lower than maybe their spouse or their partner, and that most parents in Washington state would approve. Now, we didn't ask the children or the youth what they thought. It would be interesting to ask them in the future. But I imagine most of them would appreciate that, especially if it was done in a collaborative way. So there might be some misperceptions there. But overwhelmingly, we felt very positive here in that we had strong injunctive norms to support these conversations. %, or about 3/4, indicated it was moderately or extremely easy to engage in conversations with their child to help them learn about safe driving practices. Now, again, this is from the perspective of the parent. And a parent can have a sense that the conversation is going really well, that it's even a conversation. And the perspective of the child might be like, this wasn't a conversation at all. You just told me what to do, and I never got to engage in dialogue. So whether it's really a conversation or not is difficult to say, but nonetheless, there was some strength and some confidence in the parents to engage in these conversations. And there's room to grow it, right? We can grow this for sure. But about 1/4 were moderately or more likely to feel awkward or not know what to say about safe driving. So they might need some help there, like what would I talk about? What would this look like? How would I have this conversation? And about a similar level, we're a little bit concerned in terms of maybe having this conversation if they didn't feel so good about their own driving skills, and therefore not wanting to talk about it with their child. And that's clearly a more complicated conversation, but recognizing that there's a wide array of things we can talk about in terms of safe driving, not just the mechanics of operating the vehicle, but all the decisions in various contexts, all the information that a driver is processing when they come up to an intersection or driving on a highway or in so many different settings. And just having a parent process that out loud with their child could really help their child. So what I really take from this is they've got some confidence to engage in these conversations, which is good. It would be really daunting if this number was super low, but this number's in a good place. And there's a great opportunity, I think, for us to give more guidance to parents to have constructive, good conversations around this. And maybe even, maybe especially with the younger ones who they might not feel like are paying attention, or what would I talk about? They're not behind the wheel. And 40% were wanting to say something about safe driving to their child, but finding them not wanting to talk about it. So this is also, how we have these conversations is so important. It's not just the content, but how we have the conversations. And we definitely see this in other work that we do in terms of supporting parents having important conversations with their children, let's say about underage drinking or misuse of substances. And that we need to give some guidance about how to have good conversations and what that can look like, and that it's not a lecture. And a child may ask us about a time when we as an adult made a mistake, and we need to be comfortable to be able to own up to that and be vulnerable and say, yeah, the move I made there wasn't a good move, and I regret doing it. And given the chance, I wouldn't make the same decision. but we need parents and everybody to be comfortable with that. But this notion of a sense that their child isn't wanting to talk to them may not be entirely accurate and may also reflect that both the children and the adults need some skills in having constructive conversations. Another area that was really interesting for us, and it's an area that we're continuing to do some research on at the center, is the relationship between social and emotional skills and engaging in various behaviors around health and safety. So we included on this survey what's called the Wang and Law Emotional Intelligence Scale. And it's one of several scales that are out there that help assess an adult's emotional intelligence or social and emotional skills. And these are skills like self-awareness. How aware am I of my own feelings and emotions? How well am I able to manage my feelings and emotions? How well am I able to understand the feelings and emotions of others? How well am I able to engage in constructive relationships with others? And how well do I make decisions overall and the recognition of impact of emotions and feelings on my decisions? And so we're looking at how do these skills among parents relate to protective behaviors and things like that. And we found a moderately strong correlation here. It was a correlation of 0.3, very much statistically significant, that parents with stronger social and emotional skills did engage in these conversations more than parents with lower social and emotional skills. If you're not in the education arena, you might not be aware, but there are a lot of school systems across the nation who are doing a lot of work to bolster the social and emotional skills of children as a part of their education. There's a lot of research that shows when we grow the social and emotional skills of children, they do better in school, they have better outcomes, they have better job performance, they have better job attainment and retainment. And there's a lot of research that shows growing social and emotional skills is protective for youth with their better health. So they avoid risky behaviors, they're more likely to engage in protective behaviors. There's also a lot of work now done amongst workplaces to grow social and emotional skills. Emotional intelligence, it's often called in the workplace arena, because leaders who have stronger social and emotional skills tend to be better leaders, and teams that have stronger social and emotional skills tend to have better productivity. So a lot of workplaces are seeking to grow the emotional intelligence of their employees. So we're looking at that and how it intersects with protective behaviors. We're also doing work at the center to look at how social and emotional skills directly relate to traffic safety behaviors. So on this survey, we also asked parents about their engagement in a wide array of risky or protective behaviors themselves. Do you wear a seatbelt? Do you speed? Do you drive after drinking? Are you likely to accelerate and try to get through a yellow light as opposed to pausing and trying to stop? Do you ever run stop signs? I mean, we looked at an array of different behaviors. We also found a moderate correlation. It was a 0.36 between their social and emotional skills and their safe driving behaviors. We have a PhD student, Jubair Ahmed, whose PhD is particularly looking at this issue of social and emotional skills, emotional intelligence, and engagement in risky behaviors. He's right now analyzing data from commercial operators of commercial vehicles. These are large tankers and other large trucks, and looking at their self-reported engagement in risky behaviors, but also looking at data that comes from onboard monitoring systems. So we're actually able to analyze their driving behavior from onboard systems that are in their trucks that are monitoring all of their, whether they're speeding, whether they're rapidly decelerating or braking, all sorts of different behaviors. And then we're going to look at that association with their social and emotional skills. He's done some other work on self-report, and he's also finding relationships between social and emotional skills and driving skills. So it's just a really interesting area and something that we're really curious about. So I just want to quickly summarize some of the highlights we had, and then we're gonna explore two ideas that we're sort of pondering at the center. So most of the respondents, 6 out of 10 agreed that they'd like to improve the safety of their driving. I think that's just interesting to begin with, right? 6 out of 10 parents in this case were interested in improving the safety of their own driving. That's just a big opportunity, I think, for all of us working in traffic safety. Most parents, 9 out of 10, indicated they were moderately to extremely concerned about their child learning to drive safely. So that's a great place to begin with this conversation and this work. Parents reported a higher willingness to engage in these conversations than actually engaging in the conversations with their kids. So their willingness to engage in these conversations was higher than their actual behavior of engaging in these conversations. And when we see that as a team, we recognize, okay, that means they need some help doing it. They kind of want to do it, they're willing to do it, but they're not doing it maybe because they need some guidance, some cues, some more help just doing it. But again, it's a great place to begin that we've got this willingness and we have an opportunity to grow those behaviors. We saw a number of parents engaging in the behaviors, but room to grow for sure. And really interesting that most parents reported they'd be moderately or more interested in having access to resources, in particular online resources in this case. And of course, this was a biased sample because everybody taking the survey was online. So these folks have access to online resources. But nonetheless, it's interesting to see that they, at the beginning, without any more background information, had an interest in this topic and an interest to learn more about them, potentially pursue online resources. So we really feel like that's a cool place to be in to continue to explore this opportunity. Now I want to turn it back over to Annmarie to talk a little bit about some ideas to ponder.
Oh, I don't know, ideas to ponder. So I think I was going to chat a little bit about Parenting Montana. And so we're currently involved. Yeah, that might be better.
Okay,
what were you thinking there?
Yeah, I just thought I'd pass it over to you early, but that's fine. So one of the things we always think about at the center through our work, so we're the Center for Health and Safety Culture, and so we think about culture a lot. And we like to think about culture through the lens of the social ecology. If you have a public health background, you're very familiar with the social ecology. Other folks, I think, are learning more about the social ecology or the social environment, and it's this recognition that individuals live and grow up in the context of nested relationships, right? As very young children, we often live in families. In those families, we learn a lot from our immediate caregivers and our family members. We get a little bit older, we go to school, we learn a lot in school, from school, as well as our peers. As adults, we're in workplaces, we learn a lot from our workplaces. We also engage with a lot of other workplaces in our community, like we might have a healthcare provider, and workplaces is limiting. We want to think really about organizations. We might be part of a faith community, and they will influence our beliefs. We might be involved with a wide variety of different organizations that influence our beliefs. And then our community and the laws that we have within our community and the way our community invests its resources will influence us, and on, a state, a region, a nation. And when we think about culture, and particularly traffic safety culture, we recognize that it resides across the social ecology. So when we think about growing traffic safety, we think about it through the lens of growing traffic safety culture, and we want to think, where are opportunities to do that across the social ecology? We can't just do it with individual drivers because culture resides across the social ecology, and we really want to embed improved health and safety, in this case traffic safety, in all those layers. What can workplaces do? What can schools do? What can communities do? What can states do? And in this case, what can families do? And I think this is just a really interesting study that we're involved with here to recognize families could do a lot and are interested in doing a lot in growing the next generation of safe drivers. And so there's definitely opportunities to think about growing traffic safety culture by working in the family context, promoting more family conversations, family rules, and family teaching about safe driving. Now, I want to shift a little bit more to Annmarie and have her talk about some other work we've done in that context in terms of working with parents.
Yeah, so that, thanks, Jay. So we talked briefly about the 5 parenting behaviors, and those really are the focus of a project that we're working on called parentingmontana.org. And the purpose of that project is to promote healthy mental, emotional, and behavioral development of Montana's children by actively growing their social and emotional skills. And it's really given us an opportunity to think about engaging parents in those 5 steps on a wide variety of issues from birth to age 19, from things like anger all the way to chores or homework or things like that. And so we're learning how to do this, how to teach this to parents. And currently we aren't doing traffic safety work, but there's an opportunity there to do that and to model that work off of what's been done from Parenting Montana.
So yeah, I think that's great. We just see this interesting opportunity to provide tools for parents to have these important conversations, to think about those 5 steps, you know, getting input, teaching, practicing, supporting, and recognizing as a really good process that they can engage with on so many different issues with youth to grow health and safe behaviors and skills. So great. Thanks. Something else we're pondering is I think sometimes we may look at driving as skills focused on operating a vehicle, and it absolutely includes that, right? The driver is operating this huge machine with a lot of mass, often at very high speeds, and a lot of skills are incredibly important in order to do that well. And it's just interesting, as I mentioned at the center, we're really thinking about this task of driving also as a social and emotional skill. So how am I understanding my own emotions as I drive? Am I getting angry when I drive? How does that result in what I do as a driver? Am I staying focused on the driving task, or am I distracted by others in the vehicle? And how do I navigate those relationships? Do I feel obligated to talk to a friend who's talking to me, or am I comfortable to say, hey, I'm focusing on the driving, or something like that? Also, how do I anticipate and understand the needs of all the other vehicles that are surrounding me? And that's an inherently social activity, right? Can I see that somebody's going to need some space? Am I managing space around me to create opportunities for other vehicles to navigate and maneuver as they might need? Am I anticipating, slowing down of other vehicles, just other people's needs, so that I can create sort of a social relationship where we're all safe? And it's just continually interesting to explore this. I think it's fascinating. There's definitely exploration around this. There's been quite a bit of work looking at social and emotional skills and things like aggressive driving. I think it's also intersecting with aspects of impaired driving, but we really want to look at it as even broader and wide array than that. So that's just another area where we're excited to continue to explore as a center, and just offer that as something that you might consider pondering if you're in this domain of traffic safety or improving health and safety. So I want to shift a little bit, do a little bit of just connection with some other things that are going on at the center for you. We do have regular open trainings on our approach that we use to growing health and safety in community. It's an approach, as Annmarie mentioned at the beginning, that applies to a wide variety of behaviors. We used to do this face-to-face training. We hope to do face-to-face training someday in the future, but now we're doing it as virtual training. We had a session in January, which is great. Our February session is full. If you're interested, just look for an upcoming announcement about our August training. That'll be the next time we'll have an open training. We also have an upcoming training on the science of stigma. This will be led by some folks at the center. It will be virtual. Class size is limited, so if you're interested, you want to register soon. It'll be a couple of sessions over a couple of days. I think stigma is something we absolutely need to look at in traffic safety. We know a lot of folks involved in serious injury and fatal crashes are impaired, and there's a lot of issues around addressing underlying substance use disorders that are caught up in issues of stigma. And I think in traffic safety, we need to lean into this problem. We need to make sure that traffic safety messaging isn't inadvertently creating stigma and inhibiting people getting the treatment they need to address the underlying substance misuse disorder, so we really stop the impaired driving. So I think it absolutely has connections to traffic safety actually in a big way. So you might be interested in that. You can hop on our website to learn more about these. Our website's listed in the bottom corner. Just so you know, these are other services and things that we do at the center. We do training on a variety of different issues. We also engage in extended services with people who are trying to improve health and safety, which we call guide service. We routinely do assessments, surveys, and evaluation. On our website, we've got a number of other webinars that are available for folks that you can watch. Some of them are webinars. Also, we have shorter videos that you can watch to learn more pieces as well. At this point, I hope you can feel free to share any questions or comments in the Q&A or the chat box. One had already come in, which is, will we have access to the presentation later? So yes, this is being recorded, and a recording of this will be available so you could play it asynchronously. You know, you could share the link with other folks so that they could watch it on their own time, or you could play parts of it to share. We will also put a copy of the slides up so you could use those, and we'll also put a copy of what we call the key findings report from the survey, which has a little bit more information, a little bit detail in it, but I've summarized much of what's in this webinar, but we'll make that report available too. So those will be on our website in a couple of days. It just takes a little while to get the video downloaded, and then those will be available so you can get access to that information as well. Any other questions or comments that you may have that you want to include, feel free to put in the Q&A box or the chat box. I'll keep an eye on that for the next couple of minutes to see if there's anything we can address. If you want to follow us, we are on social media, so you can connect to that, and just also checking in with our website, which just has a lot of other resources and other webinars on it. We've got some good webinars, resources about driving under the influence of cannabis, so that might be interesting. Let's see. Is there a list of all the questions you asked parents for us to access? So many of those are on the key findings report, so that would absolutely include much of that. So there are elements there. Let's see, what else?
And then I think a question came in, Jay, about if there's any initiatives currently underway to apply the core elements of the findings.
We do not have any current active projects on that. If you're interested in doing something on that, we'd love to connect with you. If you're a potential sponsor, we work with all sorts of different sponsors, but we'd love to explore this more. Jubair, our PhD student, will be wrapping up his work. I think his goal is to get his PhD at the end of this summer. So he's working on analyzing the data that we collected from the commercial drivers right now, I believe. He's also in the midst of developing a tool to look at social and emotional skills in the context of driving, and he's going to be testing that tool over the next several months, and then he'll wrap that up this summer. Clarification, there's a difference between learning to drive safely and driving safely, absolutely. Among all those key driving concerns, this newest donuts and intersections, driving danger, any discussion going with that? Have not specifically looked at that behavior, so don't have anything to add to that specific question. Who can I call to try and set up one of these free courses with my staff at the Tennessee Highway Safety? So on our website, there's a contact us, so you can use that as an email link that would allow you to, that gets an email to us. So that might be the easiest way to reach us. I think you might be able to, any of the emails you've received about this webinar, you might be able to respond to those as well. But certainly on our website, if you go to the contact us, is probably the easiest way. Are you aware of any states that require parent responsibilities for initial licensing? I'm not, but that's not something that we've studied, so they could be out there, but I'm not aware of that. Many states, have that requirement of having a driver, or somebody seeking a license to have some time behind the wheel, but I haven't seen it in terms of parent responsibilities. I need to get to my next meeting. Thank you. Thank you. Okay. I'm wondering if key facts for parents help generate more discussion with their teen driver may send as a hard copy through schools. I think there are a wide variety of ways to reach parents. So online might be a resource, but I think there are also ways to think about hard copies and other things. And then, often through schools and partnerships, a lot of folks are reaching parents. So I think there are interesting opportunities for partnering with other people who are connecting with parents to be able to share ideas like this and some of those information. So parents get a lot of information about their children, and I think there's just a wide array of ways that we could potentially reach parents. Another one came in, research that shows teaching kids to walk and bike safely relates to them being more prepared to driving as teens. That's a very interesting question. So the question again is there research showing that teaching kids to walk and bike safely relates to them being more prepared to drive as teens or young adults? I haven't seen that. I wouldn't be surprised if it's out there. That's a great research question. We need to look into that, but I don't know right offhand. Let's see. All right. So I'm mindful of the time. Really want to appreciate all of you joining us this afternoon or this morning, depending upon your time zone. Really appreciate the work that you do to improve health and safety, whether you work at the national level, the state level, or the community level. This is so important. I don't think many people realize that driving, as Shelley Baldwin at the Washington Traffic Safety Commission says, driving is one of the most dangerous things we do, and absolutely one of the most dangerous things that adolescents do. And I think we just need to really elevate traffic safety to be this big public health issue that it is, and get more and more stakeholders to think about it, talk about it, and take efforts to improve our traffic safety culture. So thanks so much today. And Annmarie, anything else you'd like to say?
Not at all. Thanks.
All right. Take care.